On this episode of Skinfiction, we're pulling back the curtain on the top 3 devices I've laid to rest in my practice. You may have heard of these popular treatments, but I'll explain why they're best left in the graveyard. Don't worry, I'll also introduce you to effective alternatives for each one of these technologies, ensuring you get the results you're after. So let's dig in. Hello again, beautiful people. Or since this is our Skinfiction Halloween Special, let me welcome all of you beautiful ghouls and boys. It's Dr. Dima here, your favorite cosmetic laser surgeon and anti-aging expert. Today on Skinfiction, in the spirit of Halloween, we're taking a chilling tour through my laser graveyard. About 20 years ago, I came up with a PowerPoint slide for my energy-based devices lectures called The Technology Graveyard, where I buried millions of dollars worth of devices that I've used over the years that just didn't deliver what they promised. This is a really important point for both patients and doctors looking to get into the aesthetic field. They need to know this. You all need to know this. Not all energy-based devices or the companies that create them are equal. They're not created equal. I'll be sharing the top 3 devices that have met their demise in my 25 years of practice, and I'll explain why they've been laid to rest. So grab your flashlight and let's go graveyard digging. So first up, we've got the Cellulaze laser by Cynosure, not one of my top laser companies. They're kind of on my, shit list. While Cellulaze was once hailed as a revolutionary treatment for cellulite and skin tightening, it fell short in the real world results. The downtime was longer than expected. Many patients found that their results just didn't happen even after months. So imagine waiting weeks or months to see if a laser worked, only to find out that it didn't. It's like a ghost that keeps haunting you without delivering. It was also touted, by the way, as a special add-on to liposuction. The claim was that it would tighten the skin in the area after the fat was suctioned. Well, as with all devices I've owned or am thinking of bringing into my practice, I had the treatment done on myself. My jowl and neck area was treated, and 2 months later, there was really no appreciable difference. And it took me a while to heal from it. This was one of my earlier purchases in my career, and I learned the hard way. So yes, try before you buy, but then wait for the results to show up before you write the check to the company. All right, now I'm not going to leave you without an alternative. An alternative to Ghoul number 1 is a technology called nano-fractional radiofrequency microneedling. An example of this in the real world is the Venus Viva MD, which uses tiny pins to deliver heat through the skin surface. This creates thousands of micro wounds in the dermis. Basically, this stimulates the body's natural healing process. Fat kicks in and collagen and elastin production begins. This results in rejuvenated skin. We do apply a topical anesthetic for this treatment because it is painful, and we usually do anywhere from 4 to 6 treatments depending on the issue we're addressing. A similar technology is called Morpheus 8, which is very common. I also use that, but I like it more for the body than the face. There are some settings on the Morpheus that do require tumescent anesthesia, at least the way that I do it. That's where I inject a diluted form of anesthetic into the area being treated, just like the anesthetic used for liposuction, but you're still awake or you're sucking on some kind of goofy gas. I just want to mention real quick that although I teach and lecture about these technologies, I am not being paid by any of these companies to say these things. This is all just my opinion. Let's move on to our next ghoul, Coolsculpting. This treatment promises to freeze fat away, but we discovered it could leave behind more than just a chill. This laser has generated plenty of buzz in the media for non-surgical fat reduction, but it's mostly just hype without the results to back it up. Again, this is my opinion. Some patients have reported uneven results and in rare cases a phenomenon called paradoxical adipose hyperplasia, where fat actually increases rather than decreases in the area treated. But when you have a superstar promoting a technology like, I don't know, Jennifer Aniston, it's very powerful pull and it's hard to ignore as consumers, even as doctors, frankly, especially when something is touted as non-invasive alternative. In a very unfortunate case that has made the press, Linda Evangelista, the famous model, experienced this bad side effect of hyperplasia and is suing Zeltiq Aesthetics for ruining her modeling career. There's also another very bad side effect of Coolsculpting that I believe is underreported and that is actually excruciatingly painful. It's a pain that develops after abdominal treatments with Coolsculpting. It starts around 2 to 3 days after the treatment and it can last up to 2 weeks. I'm bringing this to your attention because I personally experienced this neuropathic type of pain, and it was so bad that for 2 weeks I could not see patients. I was pretty much bedridden. I ended up having to get anesthesia injected into my abdomen just so I could get some sleep. I can't imagine having patients, go through that sort of experience. There's actually a white paper on this effect, and I've given lectures about it. Each time I get roasted by the Coolsculpting reps standing in the back of the lecture hall, but it's dirty work and someone has to dish the dirt, if you know what I mean. So, it's time to throw some dirt on Coolsculpting and look for safer alternatives because not all invasive treatments are bad. An alternative is the Venus Legacy radiofrequency treatment that can shrink and tighten areas like the abdomen, the bat wings, and saddlebags. Body treatments are spaced about a week apart for 8 weeks, so the process does take a couple of months. And then I will warn you that the treatments are a bit addictive because they feel like a hot stone massage, and it's actually quite enjoyable. I want to make a point here about effectiveness, though. I am not saying in any way that you get surgical results with these non-invasive technologies, but we have many studies on the effects of radiofrequency energy on skin and even on fat. Some patients are just not ready for surgery, or they can't have surgery because they smoke too much or they have uncontrolled diabetes or heart disease. It's nice to have options for people that are not surgical candidates, and here are some results. The third ghoul we're going to talk about today is Thermage. Thermage is a very popular skin tightening treatment. I think I first learned about it in the early 2000s, and it's been around for quite some time. The results could be inconsistent and not as dramatic as many people hope. It's a very uncomfortable treatment for most. And to have an uncomfortable treatment and then wait weeks and then see little to no improvement, it's just not a good look. I've seen and treated some burns caused by Thermage and some scarring post-Thermage treatments, and unfortunately, in my opinion, one of the worst side effects can be fat loss. A couple of weeks after treatment, when all the immediate side effects like redness and swelling are gone, you seemingly look amazing. That is mostly inflammation. That makes your skin and gels look a little firmer. But a few weeks and months down the road, patients notice that they look more gaunt in the treated areas. That, my friends, is from fat loss, also known as fat atrophy. Fat in a face is liquid gold, people. It needs to be preserved. We naturally lose fat in our faces as we age, and a plump, juicy face is a sign of youth. Some docs who are fans of Thermage will say absolutely not, that I'm wrong, it doesn't touch the fat, or the older versions of the device caused fat loss. But why risk it? I suppose if you have a somewhat hefty face or neck, at least you're at less risk of being disappointed. But if you're thin to start with, I would truly avoid this technology, because why settle for something that might leave you feeling like a ghost of your former self that you then need to turn to fillers or a fat transfer to fix? We have so many newer, more effective technologies out there. So an alternative to the saggy gel and thinning skin is other types of radiofrequency and even laser devices that tighten and improve skin tone and texture. One example is ultra clear laser, especially with the surgical laser coring modality. You do need tumescent anesthesia for the more advanced procedure of ultra-clear, the more aggressive version mode. And it is a bit of a ghoulish sight afterwards, but the healing time is less than a week, believe it or not, and there's very little post-op pain, like a day at the most. So what is ultra-clear? It's the newest high-tech laser treatment that uses a cold ablative fiber laser to create controlled micro-injuries in the skin that lead to skin rejuvenation. The skin knows how to heal itself. Treatment of scars and hyperpigmentation and fine lines and wrinkles are all possible with ultra-clear. And laser coring can also treat things like acne scars, sunspots, hyperpigmentation, you name it. And it also tightens tissue. There is a lighter mode called the 3D Miracle that can be done without any anesthesia, like a lunchtime laser, and then there's also a much stronger surgical mode like I mentioned before. One of my favorite things about this amazing technology is that it can treat all skin types and colors, from very, very fair to the darkest dark. Is it plastic surgery? No. But again, not everyone is ready for the knife, and frankly, after treatments like the ones I've discussed here, you can actually put off surgery for a bit, or at least get your skin in better shape before taking the facelift plunge. All right, my beautiful ghouls and goblins, that's it for today's episode of Skinfiction. Remember, choosing the right treatment is crucial, and there are many options that are both safer and more effective. Follow our Instagram and uncover more spine-tingling delights, if you dare. If you have questions about what's haunting your skin concerns, let us know in the comments. Stay safe this Halloween, and may your skin glow without any spooky surprises. Don't forget to like, subscribe, and share this video for more chilling insights. Until next time, happy haunting!